Hi, this is Christine Crow here, and I just wanted to come in and do this quick video. I've been a business coach now for over 10 years, for example, coming close to 15 years. I've been in healthcare businesses now for 35 years, 35 years, for example, and I've run my own healthcare businesses and agencies, etc. And I just wanted to really come in just to put care providers' minds at ease, because you would have noticed, or maybe you haven't noticed, that there is a talk in the Daily Mail about how agencies are somehow ripping off the NHS. And I just want to go a bit more into that, because this is not the first time that I've heard this type of story. I've heard it multiple times over the years. This is nothing new whatsoever. It has been said over and over and over again. And I just want to put the care providers' minds, the agency owners out there that are working really hard, that are providing a really high class service, that you can still thrive in this, providing that you do the right steps. Even the REC, they're questioning and saying, look, this is a bit, short-sighted by saying we will want to ban agency that are providing band 2 and 3 staff members, healthcare workers, for example. And they're even moaning about that they've had to pay out for nurses and doctors thousands and thousands of pounds. But I'm going to go into this, and I just want you to stay to the end and listen to this video, because I think it's really important. If you are a care provider, do stay tuned, because I'm going to go into this in more detail, because you need to hear all of the story, not just one side of the story here. And I just want to be truthful with you and to let you know that this is not the end for agencies, okay? They're just starting this discussion, and this discussion has been happening for years. Even in 2015, when I had an event, they said about agency owners are ripping the NHS off, etc. We hear this all the time, okay? So let me go into this more with you. Even the REC even think that this is, and I believe so as well, that it's very short-sighted to be coming out with this aspect. So I'm just reading here from some information that I have got here. For example, it says here, proposal to restrict the use of agency workers in the NHS. And it says the NHS could be banned from using agency staff in band 2 and 3 roles. That's healthcare workers roles, for example. And asks to restrict the number of healthcare workers moving from a substantial to agency work under the new government plans. The government plans to meet this week, I believe, on Wednesday. And it is the health, Mr. West, it's West Streeting, is determined to make sure that the money will be well spent and delivered for the patients. Yes, definitely, it must happen. It's got to be well led. It's got to be a good outcome for those that use the service. I totally understand that and agree with that as well. So it says, reading on here from this is the Daily Mail, I believe that I'm reading this from, for example. Actually, it's the Nursing Times. As part of this, the government and the NHS England has announced joint plans which will go out consultation. They're talking about it right now to reduce NHS reliance on agency staff. It comes in the health service spend of 3 billion on agency staff. And this was last year. I'm just going to bring my mic over a bit more. This was last year, according to the NHS Trust, being charged up to 2,000 for one single nursing shift. Now that's probably doctors, for example, locum doctors, for example, but also they charge for nurses as well. So under this premises, the proposal, the NHS Trust would like to ban from using agency to hire temporary workers at the entry level workers, which is band 2 and 3, which is your healthcare workers, your support workers, including healthcare assistants and domestic support workers, for example. In addition, it talks about the reform would prevent NHS staff from resigning and then immediately returning to work in the healthcare service as agency staff. Look, the NHS, what they also need to do is look at how they're treating their staff members. They're exhausted. They are I've been there. I've worked in bank for the NHS in the UK. So I remember getting called constantly, back to back, even on my day off. I was being called, and I can speak like this because I'm a coach now, so it's not really affecting me in this way. And I would do long days, no appreciation. I would go without my lunches. I would go without even having a drink, for example, or made to feel bad that I was doing that. Now, if the NHS treated the workers in a respectful way and valued them, then they would stay, right? Because they're getting all of the other benefits like the pension, like, for example, health benefits. They're getting more of that than what they would do working for agency. Let's be real here, okay? Agency, yes, you get a higher rate, but you're in the NHS, you would get your pension, additional pension, that is private pension, not just state pension. You're getting health benefits. There's lots of other benefits that you will get. Your 6 weeks holiday or more, for example. You can get further training, development when you're working with the NHS. I'm not saying that working for the NHS is a bad thing. It is a good thing. It's just that for me, I found it very exhausting, and I saw a lot of exhausted people. So yeah, they're going to move and go and work for agency, for example. If they want to deter people, then they've got to treat them with respect that they deserve, and they will stay. I would have stayed. I would have been doing what I'm doing today, in all honesty, as well. So they're doing a consultation this coming week, and they're seeking views from staff, from the unions, and from NHS provider organisations as well. Now, what we have to think about is that Mr. Streeting is noted that the Chancellor, Rachel Reeves, made a 22.6 billion investment in health last month as part of the autumn budget. So he says that I am determined to make sure that the money is well spent and delivered to the patients, he said. Now, let's look at things more closely here. We've got home care. We've got clients that have got home care agencies. Clients are waiting for packages to come to them from people that are actually in the hospital waiting to be delivered. But because there's supposedly this niche group that are getting these leads, for example, it is actually preventing some providers from getting work because they are not rated with the Care Quality Commission. They've gone through that step of getting registered with CQC, and they have to wait a year, 2 years before they're actually rated, before they can actually be given work. Something's wrong here. Things are just taking too long. We've got to look at those aspects of what's happening behind the scenes, why these things are also happening as well. So, as I said, the Mr. Streeting is going to unveil the reform as well as others tomorrow during the speech at the NHS Providers Conference being held in Liverpool. Even the REC, the Recruitment Employment Confederation, said it is very short-sighted to say that you plan to ban agencies, for example. And I'm just going to go into this section here whereby it is where the REC have said, look, this is short-sighted. We shouldn't be just looking at this. Now, the NHS feel that the recruitment crisis is chronic. Yes, it is. But this is the reason why the recruitment from abroad is happening. All of these job vacancies are here to make things better. Great, wonderful, excellent. But we've also got to look at the agencies that have been supporting the NHS for a very, very long time. Now, you may see pictures of, like, they've even talked about Thornsbury Nursing, which we all know. They've done a wonderful job, and all of these big agencies have done a wonderful job. But you're seeing things like they're, on holiday constantly, they're giving away Rolex watches, etc. And they're sipping, pina coladas, fresh coconut on the beach somewhere. Running a business does not work that way. Yes, they have a holiday. Of course, they deserve to have a holiday as well. So they're basically saying as well that private agencies are raking in bumper profits from hiring out locum doctors to the hospitals, which is costing the NHS over 500 million a year. Now, I'm going to go into the NHS professionals, which is the bank nurse agency for the NHS, which is also an agency as well. And I'm going to just talk about something here. And if you can look at it yourself, it's there for public view as well. Now, they were able to get a dividend of 18 million was given to the owners of the NHS professionals, for example. 18 million pounds given to the owners, for example. They've saved the NHS 6.5 million pounds, which is really good, but the dividends were paid out, which was 18 million. Now, I'm just trying to understand how dividends are being paid out of 18 million when there's such a big crisis going on, for example. Okay? But agencies, you've got to look at what you're providing. Like they said, they're giving away Rolex watches. The big agencies, they're giving away Rolex watches. They're offering, these great luxury holidays for referrals, etc. And I think things are really being pulled out of proportion in this way, because it is not the way that it's being read. We've got to look at all of the aspects. We've got to look at all of the cogwheels that is making this happen for the NHS and what is really happening everywhere. Yeah? Not just the agencies. What's happening with the organisations in the NHS, the departments? Where is that money going to? It should be going on the patients. It should be going on the staff members. It really should. And the NHS staff workers should not be working so hard as what they're doing. They're exhausted to the point of burnout. They're stressed. When you take a job on, you should really be able to say, look, I can't work today. And then you should be able to call in an agency staff. It's not a bad thing. But look at who's got the contracts. Look at what the rates are. Why not get the best rate that an agency can give, like a smaller agency that can give, that's not going to be 2,000 for a shift? I don't know any agency owner that I work with that charges 2,000 for a shift. So who is it that you've got this contract with that you're paying all of this money out? because I haven't seen it. Now, granted, I work with small organizations, small businesses, for example, small to medium, micro businesses, women-owned businesses, etc. I have never seen that. So I think you're possibly going to the wrong people or giving the contracts to not enough of the smaller businesses that won't be charging you this rate. We have smaller businesses that are providing healthcare workers, support workers, band 2 and 3, and they're certainly not charging a massive amount of money. They're charging exactly the same as what the NHS professionals are charging per hour. So something is wrong here, and I don't know what it is, but I'm also looking, and I've been studying this, and I've been looking and going through this. I've been hearing this for years. I've been hearing this for donkey's years. This is nothing new. And what I want to say to the government, you created this Contracts Act 2015 for the small to medium-sized enterprises to be able to have an equal level playing field. There's not enough that are getting these. I apply for contracts for clients on a regular basis, and although, for example, out of 15, 12 of them got them, there's still the other 3 that didn't. Why could they not have been put in, for example? And they certainly don't charge that amount of money that I'm seeing here that's in the papers. Now, I'm not saying that, the large organizations aren't charging that, because they're large organizations. They've got lots to pay out for, and I mean a lot. So that could be why their prices are at that price. But I'm talking about from a small to medium-sized micro business point of view. They certainly are not charging £2,000 for a shift. They certainly aren't being given iPads. They certainly aren't being given holidays. They certainly aren't being given furniture vouchers. They certainly aren't being given, these referral fees, for example, besides, say, £500, for example, as a referral. So I wanted to say this video today to just for us all, to providers, to keep calm, because something, your day is coming. Your day is coming where you're going to be able to step in and provide to get the Contracts Act 2015, for you to be included by your rates that you charge. I know that you don't charge these rates. I've never seen these types of rates before, for example. And sometimes it could be a specialist rate. If someone is highly special, neurosurgeon, for example, neurology, if they're specialist, then maybe they do charge that price. But what I'm saying is, I don't want people to think that all agencies are getting this, because they're not. Some agencies are charging for a healthcare worker, they're charging like £14, £15, £16 per hour, just like how it is in the community. Not these rates that you're seeing here. It's not. So I just wanted to speak out, because, at the end of the day, the NHS also has to look at the safety of the patients, and that is important. The NHS professional, which is a bank organisation within the NHS, they're making profit. Told you, 18 million dividend. And I understand that. But don't want people to think that all agencies are ripping off the NHS. The clients and the agencies that I work with, they have got so much passion. They are nurses. Some of them are nurses themselves. Some of them are healthcare workers. They've got a passion because they want to help. They are not charging these prices. So please, before you do your consultation, please look at the smaller agencies, what their prices are, and work with them. Try them. Yes, there are a few that have got through, and I'm glad that they have, but there needs to be more. That's going to save you money, but we can't be exhausting the NHS staff that are already exhausted. I'm putting a ban that they can't use agency of a level 2 and 3, but yet you want the care staff that are working permanently in the NHS to be exhausted. That's not right, because that's not good for them and it's not good for the patient. So I just wanted to speak to you here that, Mr. Streeton, please look at these smaller agencies. Give them a go. Don't just look at the hierarchy ones. Look at the smaller companies that are willing to help and support you to grow, to help save the NHS money, to put back into the patient services. One of, a lot of our clients, they will work with you. They want to work with your budget, but you've got to let them work with your budget, not dismiss them or have a certain criteria. Oh, you must be running for 3 years, or you must have this in the bank. Please give us a go. Give the smaller agencies a go, and you will see the level of dedication and the love, care and attention that they're going to give. Same with the community home care providers that have been registered with CQC, and they're waiting for their registration to get rated by CQC in order for them to apply for contracts. There's people losing their registration because they're waiting to be registered with CQC, but yet they can't apply for contracts with yourselves, NHS, until they are rated on some majority of the task set. So this is where home care comes in. This is where you, the care provider, I'm speaking to the care providers, you need to become specialist, not just generic, because the NHS won't use you. So you need to make sure that your staff members are specialists in neuro, specialists in certain departments, that they will be used, because we have to ensure patient safety. So I just wanted to drop this in here. If you have, resonated with what I've said, I want you to, care providers, I want you to stay calm amongst this chaos that's just happening right now, and see this as an opportunity for healthcare agency owners in 2024, 2025 and beyond. Now, I've been doing the CEO challenge, the 30-day CEO challenge, and I keep mentioning that you will be faced with challenges in your healthcare business, but you've got to see the challenge as an opportunity and see what you can learn from this. What can you gain from this? What can you do to help work together in collaboration? And I will say to you now is to do what I've mentioned. Start addressing these concerns. Have a meeting. You're the private agency. Look at what services that you can provide. Look at what positives you can get out of this instead of getting worried. Let's talk about pivoting and thriving and specializing and focusing on high demand areas of need in the NHS and home care, so you don't get pushed out by the big guys. So let's look at the NHS are doing a wonderful job. They're trying to cut costs, and I understand that. And they feel that they're relying too much on the agency workers, for example. But you can provide a service still. And try and look at how you can shift and provide a high niche, become more niche in what you're providing, not just generic. Okay? Look at what opportunities you can provide for home care. There's a growing demand. When people come out of hospital, patients, they're going to need care in the community. So there's a lot of data out there. Okay, you can provide home care services, and this is a challenging time, but it also is an opportunity for you to grow as an agency, a small to medium-sized agency. I would love for you to book a free 15-minute discussion so that I can talk to you more about how you can become more specialist, how you can provide a niche service, and join me for my 30-day challenge. I'm talking today at 7 p.m. and I'm going to go into this one a bit more because this has just come up. It's in my radar, so I need to really go into this more. I'm going to put the link here in the video, the YouTube video as well. Look at marketing your team, okay, that is going to be reliable and that is high skilled support. You want high skilled staff members. In order to fit in with this new agenda, you need to provide high skilled staff, okay? These staff members need to be trained efficiently. They need to be trained in technology as well. Your service delivery is, as an agency owner, is indispensable. They need you, so don't think that they don't, okay? Look at what your pricing is for you to be able to enter the market. Highlight your price, that you provide competitive pricing whilst delivering value as well. Try and look at what other cutbacks you can do as a provider so that your costs are going to be very lean, i.e. virtual assistants, for example, your office staff costs, so that you can provide a really lean price as well to work with the NHS. Look at your tech solutions as well for scheduling and invoicing. That's going to make you stand out as well. So, agency owners, this is your moment to innovate. Don't retract. You push forward. You push forward. If you would have watched my video where I talked about Simone Biles, don't give up. I talk about becoming a Navy SEAL Team 6, and this is your moment, okay? Focus on what specialisms that you can provide and invest in training, and look forward to providing home care services as well. You need to adapt. You got to train for this and train hard, and you will get in there. But don't listen to too much, because you're going to get tangled, and then it's going to make you back off, and then you're going to be like, oh, this doesn't work. I don't like it. Push yourself forward. It's going to be painful. Push yourself forward. You can do this. So, book a free 15-minute appointment with me if you want to talk to me, because I will talk to you about how you can become a lean machine. because I want you to be trained like Simone Biles. I want you to be trained like a Navy SEAL 6 team member. We got to do that, providers. You may be small, but you are mighty. So let's do this. All right. I hope that you've enjoyed this training today, this discussion really. I look forward to speaking with you soon, and I will see you on the internet. Thank you so much. Speak with you soon. Thank you. Bye.